Hi, my name is Shannon Seppala. I'm doing my project on schizophrenia and spectrum disorders. The learning objectives that I am attempting to answer are describe the signs and symptoms of schizophrenia and related psychotic disorders, to describe the most well-replicated cognitive and neurobiological changes associated with schizophrenia, to describe the potential risk factors for the development of schizophrenia, to describe the controversies associated with clinical high-risk approaches to identifying individuals at risk for the development of schizophrenia, and to describe the treatments that work for some of the symptoms of schizophrenia. Schizophrenia and some other psychotic disorders are some of the most impairing forms of psychopathology. Many suffer in silence with these symptoms. Here are some of the psychotic disorders: schizophrenia, schizoaffective disorder, delusional disorder, schizotypal personality disorder, schizophreniform disorder, brief psychotic disorder, psychosis associated with substance abuse. The signs and symptoms of schizophrenia are delusions, hallucinations, disorganized speech and behavior, abnormal motor behavior, also known as catatonia, anhedonia, amotivation, blunted affect, and reduced speech. Delusions are false beliefs that are fixed and hard to change, even when a person is presented with conflicting information of their usual Judeo-Christian beliefs and cultures. Sometimes delusions can be so much bigger that a person believes they are Cleopatra or a great king or even Buddha. They believe that they could develop new superpowers or new abilities. They also believe that someone is controlling their thoughts and actions. Hallucinations. They are known to often be shouting at people in public when there is seemingly nothing around that is making noise, yelling at them, or making any disturbance. People are affected auditorily, visually, olfactorily, gustatorily, and somatically. Auditory is the most common. Often, people who deal with hallucinations will hear voices in their head, usually negative voices, that sometimes it is inside their head and sometimes it is outside of their head. Oftentimes it will sound like someone is coming from behind them, or sometimes they hear someone who they know. They hear that voice of someone they know saying, "You are a loser," or "Go kill yourself." Disorganized speech and behavior. Disorganized speech will be difficult to follow. They do not clearly flow with conversation. Most often they will not make any sense. It will have no logic. They're on their own train of thought. Disorganized behavior. Often they will be dressed very oddly, different, unique. Their makeup will be very different, odd, bizarre, and they'll have unusual rituals that they will partake in. It could be like an OCD behavior, or just something that's similar to Tourette. Catatonia, where this is reduced responsiveness to external environment. When a person has catatonia, That means they have not responded to anything that's happening in the real world. They are completely stuck in their own head. If something gets thrown by them, they won't flinch, they won't respond. If someone tries to talk to them, be emotional around them, they will not respond. Another one is unusual postures. They will be unresponsive to someone talking to them, someone trying to be nudging them or touching them at all. They will not respond to it in the slightest. Anhedonia and flat affect. Anhedonia is the lack of interest or drive to engage in social recreational activities. A person will still be able to enjoy these activities, but they won't have as much drive to maintain the positive outcome. It will take too much out of them to be able to go to that activity or event. Flat affect, reduced speech. Allogia, which is lack of showing emotions through facial expressions, gestures, and speech intonation. A person will see someone being emotional or see it in their face. They will not recognize it, and they will also not be able to show their own emotions through their face. They will not look sad or angry or scared. They will just have a straight face. Ten 10% or more experience types of psychotic symptoms, but few will have that experience again. Many other disorders share some of the same symptoms of schizophrenia. Schizophrenia is the primary disorder when discussing psychotic disorders, however. Cognitive neuroscience of schizophrenia. Most think of hearing voices, seeing visions, false beliefs about reality. Cognitive deficits, episodic memory, the ability to learn and take in new information or clips, episodes of one's life. They will not be able to retain that in their brain. Working memory, the ability to maintain information after a short time. These will be a problem for people who have schizophrenia. Their memory is reduced with not being able to remember their childhood or little aspects of their life, or they will just have short-term memory loss. Their processing speed is just slower and slower, whereas for a healthy individual, it's almost immediate that they retain it. The different ways to study schizophrenia through the brain is magnetic resonance imaging, or MRI, and position emission tomography. This helps us understand the brain mechanisms of the symptoms of schizophrenia and cognitive impairments found in psychosis. Severe cognitive problems equal severe negative symptoms. This is a picture of the brain. We have dorsal lateral prefrontal cortex, and that is where the episodic memory and memory area is located. That is the part of the brain that is affected for people with schizophrenia. MRIs have helped us understand more about the brain, specifically with someone with schizophrenia, and helps us understand how the brain works with someone who has schizophrenia. We have a picture of the schizophrenia brain and the healthy brain. Oftentimes we find that later on in life, a schizophrenia brain will have reduced brain volume, but as the person gets older, the larger the brain will become. Regions of the brain normally increase activity when something important happens in environment. The brain regions misfire, and that causes psychosis. Problems in working memory and cognitive control in schizophrenia are related to problems in working the function of the region of the brain. Researchers have found at this point that schizophrenia can be caused by antipsychotic medications, such as marijuana, alcohol, and tobacco. Some of the risk factors for developing schizophrenia are genetic contributions. A woman being pregnant that has a lot of stress, develops an infection, has malnutrition, or has diabetes. Hypoxia, which is being born with the lack of oxygen. Children born to older fathers, cannabis, and children who grow up in urban settings with minority or ethnic groups. There are few treatments that have been developed over time. People with these types of symptoms are followed over the 35% of the development of a psychotic disorder. 35% of them develop a psychotic disorder. There's antipsychotic medication, which is typical and atypical. Those types of medications will block the dopamine receptor, which is a large factor of schizophrenia. These types of medications can help reduce most symptoms. However, no treatments work consistently to improve cognition currently. There is evidence that people with high-risk symptoms develop psychosis of a higher rate than someone with other psychiatric symptoms. There are non-invasive omega-3 fatty acids and intensive family intervention that could reduce full-blown psychosis. That has not been fully proven as of yet. Some of the side effects of the treatments are weight gain, risk for cardiovascular illness, type 2 diabetes, and mortality. Cognitive enhancement therapy is the closest that researchers have ever gotten to treat the most symptoms. They're looking for the most effective treatments, and this is the closest. It improves cognition, functional outcome, social cognition, and protecting the gray matter, whereas the other treatments did not focus on the social cognition. The good news is that these new drugs are under exploration. There is more research that is happening right now, and there is hope that one day schizophrenia will be treated to the point of almost being cured, or hopefully being cured in the future. In conclusion, I believe I have answered each of the questions that I was hoping to answer. Thank you.